Hello, my name is Jessica Broick. I've decided to do my presentation on informing you about pacemakers. I graduated from the pacemaker program at Carnegie Institute, and this is where I was taught to learn how to read heart rhythms. And this is where I also became interested in learning more about how the pacemaker works. I currently work at Beaumont Hospital as an EKG tech and a telemetry tech. As an EKG tech, I hook up the patients to the heart monitors and make sure that there is nothing abnormal. As a telemetry tech, I'm behind the scenes making sure that the patients are safe throughout their stay and their heart rhythms are okay. I chose this topic because the leading cause of death in the United States is heart disease. And the cardiology field is very important so that we can fix these complications, and the pacemaker is the device that helps save many lives. Pacemakers have become a very sophisticated piece of equipment that's implanted in the chest cavity for arrhythmias and abnormal heart rhythms. Of the people who undergo this procedure, 59% are men and 41% are women. People who undergo the pacemaker procedure in the United States. Overview of the heart is that the heart has 4 chambers. The top 2 chambers are called the atria, and the bottom 2 chambers are called the ventricles. There's an electrical component and a mechanic component that causes the heart to pump blood and to contract. Each beat is set in motion by the electrical current within your heart. Some reasons to get a pacemaker is heart disease, damage or diseased blood vessels, constricted blood vessels. It makes the blood vessels work harder to pump the blood throughout the body. Bradycardia. This is a slow heart rhythm. Usually 60 to 100 beats per minute is normal, and we start to worry when it's below 40. Using a pacemaker will help initiate a heartbeat when this is too slow. Heart block. This is a disorder that occurs if an electrical signal is slowed or disrupted as it moves through the heart. Test performed before a doctor's suggested pacemaker, an EKG. It's the most common test used to look for abnormal heart rhythms. It's non-invasive and it's painless, and you get quick results. This is when the electrodes are attached to the patient's skin in specific areas on their chest and on their limbs, and the wires connect to the stickers. It graphs the electrical activity of your heart. Holter monitor is kind of the same thing, but it's portable, so it can watch you for a longer period of time, a couple days to a couple weeks, depending on what the doctor wants. The echocardiogram uses sound waves to produce a picture of your heart, and the stress test determines how your heart works during exercise. Symptoms a patient presents with: chest pain, shortness of breath, fainting, sweating, and dizziness. Fainting and shortness of breath and dizziness are indications for slow heart rate, and dizziness and sweating are also indications for a fast heart rate. So it just depends on what is going on. Pacemaker helps monitor and control your heartbeat. If the heartbeat is abnormal, it will send a pulse to the heart. The computer in the pacemaker stores information about your heart rhythm, which can be accessed by the doctor, and changes can be made to the settings so that the pacemaker works best for you. Hardware in the pacemaker is the pulse generator. This is the computer and the power source, and it contains a lithium battery that helps produce an electrical signal that makes your heart beat. Another part of the hardware is lead wires. It's small insulated wires that conduct electrical pulses to the generator. And then there's the electrode end positioned in the heart. There's 2 kinds of pacemakers, dual chamber and single chamber. Dual chamber pacemakers have 2 leads, one in the ventricle and one in the atria. This helps the synchrony of the heart. The synchrony is the heartbeat because first the atria contract and then the ventricles, and so that will help make sure that it goes in the same pattern. Single chamber has 1 lead in the atria and 1 in the ventricle. The one in the atria is used for bradycardia, and the one in the ventricle is used for chronic atrial fibrillation. Types of pacemaker programming. There's 2 types, demand and heart rate responsive. The heart rate responsive slows down or speeds up depending on your how active you are. The device does this by monitoring blood temperature, breathing, and other factors that determine your activity level. Demand is just always monitors your heart rhythm. Thresholds, these are programmed by how much energy you need to make the heart contract. So if the voltage is too high, the battery will drain quickly, and if it's too low, it will not stimulate a contraction. Threshold changes can indicate a developing problem with the device or with the patient. Optimizing battery life. The main objective is to make sure that the battery stays charged as long as possible. The battery drains, or when the battery drains, the patient will need to come in for another procedure to get the generator replaced. Batteries often deteriorate and drain, so they're periodically replaced. It depends on the patient, but I think they said about 7 to 13 years, but it just depends on how much energy is being used. The implantation procedure. The implant is made near the shoulder area under the collarbone. The procedure is done in a cardiac catheterization laboratory in the hospital. Local anesthesia is given so that the area is numb and the patient doesn't feel any pain. The patient is awake during the procedure. The patient is given a sedative to help them stay calm and relaxed. They're also given an antibiotic to make sure that there's no infection occurring where the pacemaker was placed. A small incision is made where the pacemaker is placed, and then the entire procedure only takes a few hours. The pacemaker lead is inserted through the heart or into the heart through a blood vessel which runs under the collarbone. The lead is then attached to the generator. Once the procedure is completed, the patient will go through a recovery phase for several hours. For a few days to a few weeks after the surgery, the patient can feel some pain, swelling, tenderness where the pacemaker was placed. The pain is usually mild, so over-the-counter medications will suffice for the pain. For a month, the patient is recommended not to lift any heavy things or do vigorous exercise because the lead wire can dislodge from the generator. Some risks with the procedure include blood vessel or nerve damage, collapsed lung, or a bad reaction to the medication. Some simple risks include swelling, bruising, or infection where the pacemaker was placed. Usually they say the pacemaker surgery is generally safe. Lifestyle after your pacemaker. You're advised to avoid close and prolonged contact with electrical devices that have strong magnetic fields, like metal detectors, cell phones, or household appliances. These devices can disrupt the electrical signal and stop it from working properly, and you may not be able to tell that your pacemaker has been affected. But for the most part, they tell you to live a normal life and not to worry so much, just when you're around things that can disrupt the electrical currents. Technology is used to help save patients' lives has come a long way since the first pacemaker, which was the size of a hockey puck. Today they're the size of a grain of rice. It's amazing to be able to come along this far in the health field. I hope you enjoyed learning about pacemaker devices as much as I did. Thank you.